Hello, my name is Veronica Coburn, and I'm giving my persuasive speech on quitting smoking. I would like to say that I'm not here to judge anyone for smoking. That is their right and privilege. I'm here to give you just a few of the gory details of the long-term effects that smoking has on your body. I am also going to speak about how to quit if that is what you really want to do. If you do not want or feel the need to quit at this time, nothing that I can say will help you with your quest. I have found this out through personal experience as I smoked for over 21 years before quitting. Many people experience the "what if I relapse?" That is fine, just as long as you don't do it every day and you make an honest effort to try and continue quitting smoking. Many people did it while I was going through the smoking cessation classes. Personally, I knew that I realized that I had to quit smoking and I could never have a cigarette in my hand or my mouth ever again. Otherwise, I would not be able to quit. Now, I can't lie. I still have dreams of smoking cigarettes, and to me, it's not as harmful as actually doing it, so I don't see the harm in it. There is no set-in-stone way to quit smoking. Everyone is different. Everyone has different stresses in their lives, and everyone has different levels of tolerances or willpower. A few of the hardest cigarettes that was for me to quit smoking throughout the day were the morning cigarette, 2 after meal cigarettes, 3, going to the movies and having to wait till the end of the movie to actually go outside and have a cigarette. Number 4, the getting in the car cigarette. You all know what I'm talking about. You have to start your cigarette before you can even start your car. And number 5, the right before I go to bed cigarette. Right here I have a website that gives you a list of 101 things that you can do instead of smoke. Number 74 is my favorite. Now, see, I don't want to give away which one it is, so you'll have to go to the site and see for yourself. It's http://quitsmoking.about.com/od/cravings and urges /a/101 things to do.htm. Now, most of you realize that smoking is not good for your health. For instance, we all know it's not good for our lungs. But let's see here. This picture right here is of healthy lungs. This picture right here is smoker's lungs. These are what we know of to happen when we smoke. But what else does smoking cigarettes cause? Well, according to the American Cancer Society at www.cancer.org, 440,000 people die each year from tobacco use. Smoking cigarettes can cause cancer in your lungs, your larynx or your voice box, oral cavity, throat, esophagus, and is a contributing cause to the development of cancers in the bladder, the pancreas, the liver, uterine, cervix, kidney, stomach, colon, and rectum, and some leukemias. 87% of the lung cancer deaths are caused by smoking. At this site, they can also say that smoking is a major cause of heart disease, bronchitis, emphysema, and stroke, and contributes to the severity of pneumonia. Tobacco also damages women's reproductive organs and is associated with possible increased risks of miscarriages, premature births, stillborns, sudden infant death syndrome, and is a cause of low birth weight in infants. Now that we realize some of the things that smoking cigarettes can do to your internal organs, let's take a look at your exterior. First off, you do not need anyone to tell you that your fingernails are stained and yellow from tobacco while you're smoking. But worse than that, there's premature aging. I learned that smoking caused your blood vessels to become narrower at dermatologycare.ca. Because of the decrease in blood flow, smoking makes it difficult for oxygen to get to your skin. Over time, while you're not looking, the slow side effects of smoking causes discoloration, wrinkles, and sagging in your face, making you look much older than you actually are. Your teeth, gums, and breath are more problems caused by smoking. Your teeth become stained and yellow from extensive smoking. It is also one of the reasons that gums disease starts. With this, over time you could actually lose your teeth. Your breath is another thing that is just bothersome. No matter how much you try, if you smoke, your breath will smell like an ashtray. StopSmokingTips.com says that smoking and bad breath are inseparable. It also states that our saliva is like a natural mouthwash. For instance, the more saliva you produce, the greater your chances are of having bad breath. Your tongue is not immune to all of this smoking either. Every time you smoke, you are killing your taste buds. This is why many individuals that smoke increase their sodium to add flavor to their food when actually there is no need for it. At Associated Content, there was an article which stated when trying to sell your home, you could run into problems as well if you're a smoker. First, there's the odor, which most non-smokers can and will notice. The drywall and carpets can absorb the smoke and make it very difficult to get rid of. Without noticing, there could be places in your home that have cigarette marks. You know, where you placed your cigarette just for a moment and then, oops, forgot that it was there. Nicotine can also stain your walls and making it again difficult to get rid of the odor. The smell of smoke also lingers on your clothing. Even after you've washed your clothes, you can still smell it. Alright, let's take a look at secondhand smoking involving children now. The American Lung Association states that there are 400,000 to 1 million cases of asthma in the United States, contributed by secondhand smoke in children. There are also 150,000 to 300,000 cases of pneumonia and bronchitis each year in children 18 months and younger.